I've always been uncomfortable with masking being something that's applied as an aspect of being autistic, because I think autistic people have much less of an inclination to be inauthentic. I mean, it's not a great virtue, it's just not a choice. It's much harder for an autistic person to be inauthentic. Authenticity is a central part of what it is to be autistic, I believe. And I think autistic people only do it when there's no choice at all. When it seems to be something, it's the only way to avoid condemnation or disdain or whatever it is. So, Andrew, in the world of autism, we often hear talk of something called masking. What is that, and how does it affect young autistic children?
Yeah, masking. The way that I think about masking is, it starts for me with sort of the literal understanding of the word, which is to wear a mask, right? And when people wear masks, we are essentially hiding our true faces, what we really look like. And so, really, I think it's a brilliant term that when I think about autistic people, what can happen starting at very young ages for autistic children is when autistic children repeatedly get the message from the environment that they're in and from the significant people around them, their families, their caregivers, perhaps their school staff, whoever it might be, when they get the message that who they are authentically is not okay and needs to be different, right? So when they get the message that the way they're communicating, the way that they look, the way that they act, the way that they're thinking or what they're interested in, when they get the message from the world around them that there's something sort of wrong with that, right? Who I naturally am or what I'm interested in, what I like, the way that I communicate or talk, or the way that I play with toys needs to be changed because there's something wrong with it. When that message comes in, children start to learn that they have to change who they are to be accepted and loved by the people around them. Now, globally, that's not unique to autistic people, right? All of us have that experience to some degree. As we're growing up, we want to be loved and accepted by the people around us. So essentially, we do whatever we need to do to try to fit in, to try to get people's love and approval and acceptance. But because we live in societies that are profoundly, in many ways, not accepting of autistic ways of communicating, ways of being in the world, there's a very narrowly defined way of being that's accepted kind of by dominant societies or cultures, which is, again, to look a certain way, talk a certain way, act a certain way, that is quote unquote neurotypical and not autistic. And I think that what we're learning now is because autistic people have to work so hard to mask who they really are and hide essentially who they authentically are on the inside, that's not only an exhausting process, but it's also a very, it eats away at a person's self-esteem or sense of themselves, that sort of who I am at the core isn't okay, isn't acceptable. And so I think that has, what we're learning now, of course, from autistic people, is that has a huge impact on longer term on people's mental health and people's confidence in the world.
Yeah, and I guess it can happen in different ways as well, because in my experience, I've been autistic for most of my life without knowing that I was autistic. And I think masking for me, it wasn't something that I consciously did. It was something that I just imbibed, that the way I wasn't acceptable and I needed to do things in certain ways. sometimes I just thought, well, I would have just assumed that the way to do these things was just as difficult for anybody else as it was for me, and people were just better at it, and I just had to try harder. And when I came across this idea of masking, I wasn't really very comfortable with it. I wasn't really very comfortable with it being applied to autism, because in my experience, I'd never made a conscious effort to hide who I was. I'd done it unconsciously. I'd sort of done it through what I picked up about what was and wasn't acceptable. And masking seemed to me to have, some value judgments inherent within it. So, somebody is deliberately masking. I was thinking, well, that's about hiding who they are, presenting themselves as something other than they actually were. And that seemed to me to be something that people who are not autistic do much more readily than autistic people. For example, smiling and telling people, treating people like good friends when they actually can't stand the other person, and that sort of thing, which an autistic person just doesn't have the machinery to do. I couldn't do that. But then I thought about it a bit more, and I think within autism, there are a lot of autistic people. I've heard from autistic people who actually do consciously make that effort to show themselves as different from who they really are as well, because they've been told, probably very explicitly many times, that how they are is not acceptable, and so they make the choice to change how they behave in order to be acceptable to somebody else.
Yeah, I can just say, Guy, that I think what you're speaking to, or what you're spotlighting, is so critical. That I think what's happened is that there is actually something that's incredibly important and powerful that you said about as a young autistic person, almost not being able to mask fully in a certain way, that when you, for example, when you had the experience of, I don't like this person or I don't trust this person, it was too much of a stretch for you to kind of put a fake smile on your face and be very warm and friendly towards someone who, like, your body and your heart is sort of reacting, really strongly to. And I think what's so interesting and important about that is that if I go back to my own experiences interacting with autistic people, developmentally disabled people earlier in my career, one of the things that I was immediately struck by and immediately admired and respected about them was their complete authenticity with what they were thinking or feeling on the inside. Their sort of inability, when they didn't feel like they trusted me, or when we'd had a difficult interaction, they were sort of wearing that, showing that, not sort of putting on a smile to make me feel okay. And I remember thinking about that and thinking, my gosh, I've trained myself so well as kind of a neurotypical person to kind of be fake and paint this smile on my face. And I'm not sure that's, it has survival value, right? But I'm not sure it's such a good thing. Yeah. We have to start thinking about and talking about the cost of living in societies that are shaping us, training us to be who we are not authentically. That's really problematic. And I think that's where the awareness and blame need to sit more than on individual people.
Yeah. And I think that's maybe why I've always been uncomfortable with masking being something that's applied as an aspect of being autistic, because I actually think that autistic people have much less inclination. I mean, I'm not saying it's good for anybody. I'm not saying anybody has a drive to be inauthentic, but I think autistic people have much less of an inclination to be inauthentic, and are much more, naturally. I mean, it's not a great virtue. It's just not a choice. It's not a choice. It's much harder for an autistic person to be inauthentic. Authenticity is a central part of what it is to be autistic, I believe. And I think autistic people only do it when there's no choice at all. When it seems to be something, it's the only way to avoid condemnation or disdain or whatever it is. So yeah, I mean, I think it's deeply painful. I mean, and we talk about masking being harmful for autistic children and autistic people. It is, but it's much more harmful than it would be for somebody else, because the authenticity is much more central to who they are anyway.
Yes, yes.
So to bring it back to a family, what would parents notice in their young children? What signs might there be that the child is masking? And what can the parent do to create an environment where the child doesn't feel the need to mask, at least at home?
Yeah, I think that's a very powerful question. And I think it starts when parents don't have an awareness or an understanding that they actually may have expectations for their child to act or be or communicate or play in certain ways that they consider normal, acceptable, typical. So when that's, in many ways, when that's sort of unexamined, and when parents aren't even aware that they might be giving their kid messages that you're not okay as you are, your communication is not okay, the way that you're playing with toys is not okay, the way that you're acting or behaving is not okay. That where I always start with families and with parents is as soon as possible. It's so important to give your child the message that I see you for who you are naturally and authentically, which means whenever a child makes an initiative, whenever they say something or are interested in something or look at something in a certain way or play with something, it's really important for the parents to receive that, to recognize that initiative and really confirm it and acknowledge it and give the child the message that I see you and who you are in terms of how you're communicating right now, how you're playing with a toy, what you're interested in is okay, and I appreciate you for who you are, instead of I'm trying to change you, I'm trying to get you to be different. And I think that we, again, at least in the US, and I think this is true to some degree in the UK, but not as much, but in the US, the system trains parents to see their kids as broken and deficient and in need of changing very early on and very rapidly. So parents do not get encouragement to just be with their kids in ways that are accepting, in ways that are communicating to the child, I see you, I'm with you, I appreciate you, I accept you for who you are. We have a whole system that's based on telling parents that their kids are deficient and need to immediately be fixed or changed. So I start there with parents and with really like, slow down, calm down, and really begin to notice who your child is and what's unique about them. And I also help parents really notice what they enjoy and love about their kids. Because all parents see their kids, uniqueness and idiosyncrasies and interests. And it's usually only until they get the message from either the community around them or the professionals around them that they start to get really panicked about it.
So the parents have excuse me, I think I'm going to... excuse me. So the parents have a huge job to do, I guess.
Yes.
In that really noticing where they might be, and I guess we've talked about this on a lot of the other conversations we've had, but noticing where they might be not giving the child the message that the child is fine and the way that the child is, and not to feel anxious that the child might not be developing as they would expect the child to develop, and almost look for opportunities to show the child, you are acceptable, I love you as you are, whatever you're doing, however you are, however your way of managing things, that's fully acceptable for me. And to communicate that to the child, not in words obviously, but just in reactions, in behaviour, to give the child a sense that they can, in that environment at least, in their home environment, they can be who they want to be, who they are, and they can behave how they naturally behave without having to pretend.
Yes, absolutely, Guy. That's it. That's exactly it. And I think that um, it's actually incredibly simple, that idea. And parents, I think, when their children are really young, I think parents have that ability very naturally to be with their babies,
Yeah.
and enjoy their babies, and reflect back to their babies, whatever the baby's feeling or doing or babbling or thinking. Parents have an ability to be with and sort of reflect back love and acceptance to their babies. Very quickly, though, what happens is that changes, and parents begin to try really hard to get certain responses and to shape and to teach and to, essentially change their kids into who they want them to become. And I think part of what's hard, Guy, honestly, and I've had to do a lot of work on myself and in my own life as I've become better able to honestly to be with myself and with the people and with people in my life in general, but also with the in supporting the autistic people, and their parents and their families. I grew up in an environment in my own life, in my own family, where my parents, because of their own experiences in childhood growing up, didn't learn unconditional love and acceptance. They never had that modeled for them. They didn't receive that from their own parents. My mom, for example, grew up in World War II Austria, right? And so she was surrounded by people who were highly anxious and really terrified, and she got messages growing up all the time that she had to look or act a certain way or be a certain way in order to get love and approval. And so she didn't know any better. So in many ways, she did her very best to try to love and accept me, but it was very difficult for her to do that for many reasons. So I didn't have that template inside of me. I wasn't given those messages growing up as a kid. So for me to then shift and suddenly have the capacity to be able to love and accept people around me unconditionally, in many ways took some years of work for me to get to that place. And it's not that that parents have to go through like years of sort of therapy or whatever it is to get to that place. But it is important for parents to understand and to be gentle with themselves, that they may not ever have had the space or the opportunity to learn how to just relax and be with and be accepting of another human being because their parents never had that ability with them. So it really starts with that. And I think that's a big part of this work, Guy, that's been profoundly overlooked in our field. We've not learned how to truly help parents be really deeply loving and unconditionally accepting of their neurodivergent or autistic children. And I think that needs to be where we shift towards.
And it's really interesting, isn't it? It's because, from what you say, I mean, most people won't have had that extreme experience of growing up in Nazi Germany, but most people will have had some experience of not being fully accepted for who they are, and absorbing that into themselves and absorbing those judgments of themselves. So when we as parents don't give our children unconditional love and unconditional respect and unconditional acceptance, it's because we're not giving ourselves unconditional love and unconditional acceptance. And it's so in a sense that makes it a very, very positive journey to go on. In another sense, it makes it quite a difficult journey to go on as well, because it's something very deep and very deep rooted.
I think that's true, Guy. And I think part of that journey begins with, I think it's a combination of, I think what we've seen, and this is what I think has been most damaging to families in the US in terms of the dominant models of autism care that we've adopted. Those models push parents to be even less accepting of their children in many ways. So it's this nasty hook where parents need a lot more encouragement to just sort of slow down, as you described, to be able to be accepting of themselves as well as then of their child. And rather than having a system that encourages that, right, that has coaches, for example, that in early intervention programs are really helping families learn how to do that, both with themselves and with their children, that would then have a profound ripple effect in terms of mental health and long-term outcomes. If we had a system that was encouraging parents to be more loving and accepting of themselves and their children, I think things would look very different than they do.
So in short, it's actually one simple thing that's maybe not as simple but not easy thing for many people, which will be to really accept themselves, and through accepting themselves to be able to accept the child as they are without any preconditions, without any demands for how they should be, and by doing that they give the child the feeling that they're acceptable how they are, and they don't need to mask then, at least in the home environment. They may need to do it outside occasionally because of the nature of the world. It'll take the world a bit of time to catch up with this. But at least in the place where they want to feel safe, they want to feel is their place, they can be free.